A smartphone app, Tricycle, is making a world of difference for patients in recovery at Rushford. And to talk more about that is Michelle Votel, the clinical program manager at Rushford, part of Hartford Healthcare. Hi, Michelle. Thanks so much for joining us today.
Hi, thanks for having me.
So can you tell us a little about this smartphone app, Tricycle?
Sure, we have an app that we use with our clients. It's got two parts to it. It has an inventory and a journaling section to it. So the inventory piece has 8 questions that are recovery related. So it'll be things like, are you feeling stressed at this moment? And it'll ask how much stress. So it'll give you a scale from say 0 to 4. And are you feeling it all the time, a little bit? It'll match that with an emoji. And then you'll select where you're feeling at that time, and it provides immediate feedback to your clinical team.
That's super interesting. So you've been using this app to connect with hundreds of patients, specifically during the COVID-19 outbreak, and helped provide interventions. So how has that all worked?
Yeah, we had 759 interventions in 100 days when COVID hit. We had a really concerted, cohesive effort to pivot and get clients onto this application so that we could help them build self-awareness and connect with their team in real time.
So what about the role of the recovery support specialist in reaching those high-risk patients?
Yeah, the recovery support specialists, we call them coaches for short. Those are people who have been trained in mental health and substance use disorders. There's someone, their peer, there's someone is in recovery themselves, and they receive a red alert from the app when a client is noting that they're at risk, and they immediately are able to reach out, having proactive outreach in real time. So they're hitting the right clients, those at risk, at the right time, where we don't have to wait until the next day. We can actually be in touch with them real time and help them use coping strategies in the moment when they're outside of treatment.
Has this really changed how you're treating patients? Is this going to be part of the standard now?
It is. It's actually part of our standard work process. It's something that we call treatment expansion for accessibility. So all clients now, whether they're being discharged from an inpatient program or onboarded to Tricycle, or when they come into our other programs at all levels of care for intake, they are recommended to use the application and also to use a recovery coach in their treatment plan for recovery.
Wow, that's very interesting. Michelle, thank you so much for your time today. We appreciate it.
Absolutely. Thank you.
Take care.